Are there hidden risk factors for bladder cancer? Many people think about smoking and chemical exposure when it comes to bladder cancer, but there are also less obvious factors that can influence risk. These hidden factors might not be immediately clear but can still play a role in developing this disease. For example, certain medical conditions like diabetes, high blood pressure, and heart problems have been linked to a slightly increased risk of bladder cancer. While the exact connection isn't fully understood, systemic health issues may contribute to the overall risk profile. Genetics also matter. If you have a family history of bladder cancer, your chances of developing it are a bit higher. Although genetics account for a smaller part of cases, about 7%, knowing your family background can help you and your doctor decide on appropriate screening or preventive steps. Age and gender are important too. Bladder cancer is more common in older adults and is diagnosed more often in men than women, which suggests that hormonal or biological differences could influence risk. Environmental factors are another piece of the puzzle. For example, arsenic in drinking water has been recognized as a risk factor in some regions. Not drinking enough fluids can also be a hidden risk because it reduces urine flow, which may allow carcinogens to stay in the bladder longer and cause damage. Additionally, previous cancer treatments such as chemotherapy or radiation therapy in the pelvic area can increase the chance of developing bladder cancer later on. Chronic bladder irritation from long-term infections, bladder stones, or catheter use can also raise the risk. Infections with certain parasites like schistosoma hematobium are linked to specific types of bladder cancer, especially in parts of Africa, Asia, and South America. These infections cause ongoing inflammation, which can lead to cellular changes in the bladder lining. Environmental exposures beyond chemicals are also important. For instance, exposure to certain fumes or dust in some workplaces, like painters, metalworkers, or agricultural workers, can increase risk due to contact with harmful substances. Interestingly, some studies suggest that not drinking enough water might be a hidden factor because it concentrates carcinogens in the bladder, increasing the chance of cellular damage over time. While these factors can influence risk, it's important to remember that having one or more does not mean you will definitely develop bladder cancer. Many people with no known risk factors still get it, and some with multiple risk factors never do. The best approach is to stay aware of these hidden risks, manage chronic health conditions, avoid unnecessary chemical exposures, stay well hydrated, and have regular checkups if you're at higher risk. Always consult with healthcare professionals for personalized advice and screening options. Understanding these hidden factors can help you take proactive steps toward bladder health and early detection.